1:30. We have regrets from Mayor Davis, but the rest are here and attending. So we have quorum, and we will begin. Attendance has been taken. We are also, just to mention, streaming this on YouTube because of the electronic nature of the participation, which I think is a first for this committee, but something that we can do when we're back here as well, because we do these meetings at this chamber. It is set to do that at any time. So that's something we can do in the future. Can I get a motion on the approval of the agenda? Moved by Mayor Bailey, seconded by Councillor Martin. Any comments on the agenda? Changes or deletions? No? Then we'll ask for a vote to approve the agenda. We're just raising hands on this one. Perfect. Okay, any declarations of pecuniary interest? Seeing none, moving forward. We have no delegations, petitions, or presentations. Can I get a motion? Oh, Mayor Davis is here. Let's just wait for him to connect his audio. Noting the time, 1:32, we're good. Mayor Davis, we just started with the normal business. We're just on the adoption of the previous minutes. No one's made the motion yet, if anybody'd like to. Councillor Pierce, seconded by Councillor Martin. Any comments on the previous minutes? Councillor Pierce.
Thank you, Mr. Chair. Through you, just a couple questions as a follow-up on them. I know it's been quite some time. So I guess it's on page 2 of the previous minutes there, with respect to the looking for an additional or a different facility to house the ambulances and such. I understand things were kind of put back by COVID, but I'm just wondering if I could get an update on that as to what the status of that is. Has there been any new leads? Are we still looking to team up potentially with the Brantford Police? I'm just looking for something on that if I could.
I believe there is an update in here scheduled, but we can jump to that right now.
It does talk about part of the with the Brantford Police there, but I'm just wondering, it doesn't say, is there any other leads, or are we strictly looking at that? Or are we waiting for Canesville?
Well, I'm gonna throw that to staff room number 1, either Cindy or Russ. Want to speak to that?
Mr. Chair, it's Michael Bradley, County CAO, and I can just give a quick update that after the last meeting, I did have a couple conversations with my colleague, Mr. Hutchings, the city CAO, and I think there was some strong interest in potentially accommodating us in their upcoming police project. At the last time we talked, I think they were still looking, and maybe the city councilors could provide further context, but they were still reviewing kind of their suite of options on their new police facility, and I don't know whether that's that discussion has matured any further. But he and I were going to circle back in the what we were called the late winter, and then COVID-19 hit, and we've both been quite preoccupied. So I do think there is still a good discussion to be had with our colleagues at the city on housing that. There's some financial benefits for both parties on that, and for the service in general. So that's been basically our focus for the time being.
Thank you. Does that suffice, Councillor Pierce?
It does, and if I could, Mr. Chair, just one other additional on page 3. I guess this would be directed at Russ, if I could. In regards to the funding for the offload nurse, I just want to understand, has there been any more discussions on that? Do we know how long this is going to continue? Just a little more information on that.
We've been conducting or participating in town hall meetings with the other 50 chiefs across the province, which also included the Ministry of Health and the Deputy Minister Alison Blair. And the funding is for continuing for the 2021 season that we are aware of. They have not said they are changing anything currently.
Good to know. Thank you for that. Thank you, Mr. Chair.
So I believe we have a mover and a seconder. So if there are no other questions about, Councillor Sless? Oh, just ready to vote? Okay, so all those in favor of the approval of the previous agenda? None opposed, passes unanimously. There are no consent items to be approved, so we're moving down to number 7, consent items to be received as information. My understanding is we may start with, do you have a opening here, Cindy, or did you want to save that for staff reports?
I have a bit of an overview once we get to the budget report.
Okay, so that's line 8. So consent items to be received as information. How do we want to work with this? Do we want to separate them? Do you want to move them all as a bunch? Councillor Pierce?
Thank you, Mr. Chair, through you. I'd be willing to move them all to be received as information, but I do have a question on 7B when we get to it.
Okay. Seconded by Mayor Bailey? Or do you have a question or want to separate one?
Seconded.
Seconded? Perfect. Okay. So before we go to the vote, let's get that question from Councillor Pierce.
Thank you, Mr. Chair. Just a question on 7B. I guess it's page 10 in our package there, when it talks about the impacts, COVID-19 impacts on actuals, and it talks of vacation usage down and that sort of thing. It also says sick time. Sick time was also down. I'm trying to understand here, with vacation more or less being down and not being used, and sick time being down. Is there any correlation to this? And I hate to bring it around to this, but do we feel there's any correlation to this regarding the additional pay that was given to them, the frontline workers, in not in the sick time being down, or am I grasping at straws there? And apologize if I am.
Before I send enough to Russ, I'd like I'll piggyback on this comment as well. Just also maybe if you can speak to the fact that the capacity issues not being at 104% may also have some, people generally take less time off and are less sick when their work is more manageable. But in fact, again, might just be me grasping at straws too. So let's send it to Russ and see what he has to say.
Through you, Mr. Chair. The sick time is down. Our current policy right now dealing with COVID is that if you come up with any of the systems or symptoms that are listed out with the Ministry of Health, you must go out and get a swab. It could take anywhere from 3 to 14 days for them to come back with a negative swab, and that is not feeding into our usage of our county or say city sick time. That sick time is basically ran right through the provincial pandemic pay that we've received, so it doesn't take out of our sick time. And as Councillor Laferriere said, that if it's more manageable workload, people are taking less time off, it could be basically sick related. But with the addition, I believe, of the extra PPE and the extra precautions, the cross-contamination between our paramedics and the patients we see and stuff that we see, basically will also limit the amount of time being taken off at this point. We started early in the overall pandemic. Friends of mine in California started it off by putting a mask on every patient and putting a surgical mask on each and every paramedic going in before we had basic guidelines, which I think protected us in the long term.
Oh, you're muted, Councillor Pierce.
Yep, thank you for that. And just as a follow-up in there, and you hit it there, Russ, with the temporary pandemic pay. I've highlighted that in my package here, temporary. Is there any gut feel, or is there any whispers in the wind that we're going to have to pay this back?
To you, Mr. Chair, in all of our town hall meetings that we've had with the Deputy Minister and the Ministry of Health, we have not heard any whispers of us having to pay back any of the pandemic pay that have been given to the paramedics.
Good to know. Thank you.
We have Councillor Sless, I believe, has a question.
Yes, I did. I just wondered, when somebody's tested and you're saying it can take up to 2 weeks to get it back, is that person isolated during that period?
That is correct. The paramedic is isolated for the length of time that the test results come back. At the very beginning of this overall process, it was taking anywhere from 10 to 14 days. Currently, right now, our turnaround process on the best case scenario is less than 5.
Thank you.
Any other questions or comments on this pay? Yep, Councillor Martin.
Yeah. Do you have a count as to how many days have been lost to COVID isolation?
I do not have that figure right in front of me, but to date, only 18 of our paramedics were swabbed with COVID-related symptoms, according to the Ministry of Health list. I would say, not having the list right now, I would say between 20 to 30 days in total. And I'm talking a 24-hour day. I'm not talking just a part shift or a 12-hour shift.
Okay, and has that required part-timers to backfill, or how have you handled the absence?
Sorry, through you, Mr. Chair, right? It could be part-timers. We always would have to backfill. But again, the backfill money is the province is paying for the COVID-related time off as the person is in isolation, and that would be considered a standard shift being used through our normal budget process.
Okay, thank you.
If there's no one else, I just wanted to mention too on 7D, it's not a question, more of a comment. I just want to thank the paramedic services for the work they've done and what they've done to be flexible, to create new protocols, to help with community health, to work with prevention and swabbing and finding the calls may be down. It doesn't mean you have been doing really less work, because there's been a ton of proactive measures that the paramedics have been at the forefront on in Brantford and Brant, and while still helping out other regions who are affected. So it's really appreciated. We haven't had a meeting in almost 6 months, so we don't say it as often in a formal setting, but I know everybody on this committee feels the same way, and we just want to say it on the record. So with that, Councillor Pierce.
Thank you, Mr. Chair. Through you, if I could, on page 17, when it talks of for 7C, when it talks about the stats, I know we've had discussions on this before. I'm speaking specifically to the sudden cardiac arrest with our benchmark of 35%. We have had discussions on this regarding that number being I guess a little low in some of our minds here as a benchmark. And of course, we always seem to hit it, 52%, which is fine. What I'd be interested in, Russ, and I don't want to put a whole lot more work on your plate here by any means, but what I'd be interested in, we're talking 6 minutes here. So is the other 40% or 48% within 7 minutes? Like, I'm just trying to get a gauge here of, okay, so 52% of the time we were within that 6 minutes. I just want to get a handle on, are we 6 minutes and 30 seconds, or are we 10 minutes, or are we 12 minutes? I'm just trying to get a handle on that. Again, I don't want to put a lot of extra work into it, but I'm wondering if it's possible if we could get that sort of detail within the, with that benchmark. Is that doable?
Through you, Mr. Chair, we can run the stats and reports on any time frame. It's all built into our electronic ACR charting system. So for our next meeting, I could run the report for 6 minutes, 7, 8, or 9 minutes accordingly, so you get a better idea of where we're reaching.
I would appreciate that. As I say, I'm just curious here, because we're hitting at 52% of the time, and I'm just curious here if it was another 30 seconds and that put us to 90% of the time. That's a good thing, if you know where I'm going here. Thank you.
Can I actually suggest that when it's available, that you send that to us, or send it to Heather to send to the members of the committee, just because we don't know when our next meeting is. It's going to be a call to the chair, and I don't know when that's going to be, just based on the situation at hand. But having that information when available would be helpful, and then we can also make sure to discuss it at the next meeting. Okay, so any other comments on any of this? Okay, I have one question. We've been, both the city of Brantford and the county of Brant have had a face covering bylaw. They're both very similar. They've both been in for about 3 or 4 weeks now, I guess about 3 weeks. Just wondering, we reach out to a lot of different community agencies and the healthcare system and our medical officer of health. Does the paramedics department have a stance on the masking bylaw, or any opinion on its efficacy? Because, I know we have to, in the county, review it every month, and I think the city, it's every 2 months or so. So if you're not able to answer at this time, maybe some formal response to both councils would be appreciated, just because we should be consulting you the way we consult other agencies related to this.
I do not have a statement at this time. We've been working with the hospital closely, dealing with the masking policies, as well as the Ministry of Labor has also suggested to us, while we are in the front of our vehicles, to have the masks on at all times. But I will prepare a statement for both councils and send it off to you as soon as it's completed.
Thank you. I know we have to vote on it again on Tuesday in the county, and I think it's next month in the city. So if it can be before Tuesday, that would be excellent. Thank you. Okay, well, seeing no other questions or comments, let's all vote on items 7A, B, C, and D all together. All those in favor? None opposed? Passes unanimously. Moving on to 8, staff reports. I'm going to ask Cindy to begin this one.
Okay. So as per the report, staff have prepared the 2021 budget for committee's consideration. We do acknowledge that the budget submission is past the normal timelines outlined in the governance agreement, noting that the priority over the last few months due to COVID-19 has been focused on the operation of the service. And this has allowed us greater context and certainty at this time in formulating our budget for next year. As noted in the report, the key budget driver in 2021 is the annualization of the additional 12-hour ambulance budgeted to start mid-year in 2020. There are some other increases attributed to materials, supplies, and some utilities. The base budget presented to committee includes a 0.7% increase to the net levy overall. And there is a decision package included for an increase in the contribution to reserves to return to the amount included for last year. This is to return to a healthy reserve position and adequately fund renewal of existing assets for the 10-year capital plan included in the package. And in summary, the call volume continues to drive costs overall with changes to the system under the province's purview as outlined in the report. The staff are happy to answer any questions that committee may have.
Okay, we'll go for a round of questions. Okay, I'm trying to let anybody but Councillor Pierce start.
So am I.
No, it's okay. Councillor Pierce, your hand's up first.
Thanks. If we could go to page, there's no page mark on it, but it's within the 2021 proposed budget operating. Oh, sorry, it is page 51 on the side there. So if we look, I'm curious in regards to, so on the revenue expenses, we got salaries and then we have employee benefits. I'm trying to understand why the benefits are going down, the amount for the benefits are going down, yet the salaries are going up. Can we get some sort of understanding here? Have we changed the benefits? I'm trying to understand that change.
Cindy or Heather?
I'll take a stab at that, and Heather can join in if I've missed something. So the salaries, there's an economic adjustment there, and this is within the paramedic group for anticipated adjustments that may come in the collective bargaining negotiations. Mm-hmm. As far as decrease to benefits, it's my understanding that we're expecting an overall decrease in our premiums from our insurance carrier due to a lot of benefits this year because of COVID, weren't utilized. And so as a result, we will see a decrease in our premiums overall.
Okay, that's a good answer. Thank you.
Any other questions from anybody on the committee?
Heather has.
Councillor Martin? Oh, sorry, staff, Heather, were you wanting to add to that before we get to Councillor Martin?
Yes, just through you, Mr. Chair. It's also the WSIB has changed their rate structure. So it used to be paramedic services used to be quite high, and it's come down quite a bit. So that's decreased that number as well.
Okay.
Thank you.
Extra color on that explanation. Thank you. Councillor Martin, you have the floor.
Okay, page 47, line 13106, software support and licenses. The actuals were 11,000 lower, and yet you're increasing the budget significantly, the 24% increase. And there was an increase in 2020, but the actuals for 19 were quite a bit lower. What's the reason for the increase there?
Through you, Mr. Chair, the reason for the increases are current ACE Tech system that monitors the AVL data in all of our vehicles. That is a new increase that they provided us for this year, as also as seen in the COVID report, the situational awareness data that basically tracks the call volume and the data going into the hospital right now as the overall enhancement from our EPCR provider.
Were we not paying licenses for that software previously?
With the software previously, yes, we were, but they've increased the Ace Tech portion, which is our AVL data system. And we've also added an additional 2 vehicles. So those increased licensing fees also go up. As we add the 2 additional vehicles, our overall Toughbook licensing through our EPCR provider also goes up. It's per Toughbook, per data feed into each and every device.
Okay. Why did you budget 10,000 more than you needed in 19? What those fees were when the budget was prepared?
We did not know, because our budget is being done so early, we did not know the licensing fees at the time when we did prepare it.
Okay, and the increases reflect actual increases?
The increases do reflect actual increases.
Okay, so when we get the next actuals, it'll be closer to what you budgeted?
Correct.
Okay. Here, 43015, the cross-border neighbor. Unfortunately, the way we get this, we can't make notes on the computer. I'm trying to figure out what my concern was there, but the actuals were quite a bit different than what was budgeted. Do you expect that number the actuals to be closer to what's been budgeted in more recent years, or is that something we need to make an adjustment on?
It's more to actuals. What they're trying to do right now through the province, rather than some municipalities paying for the cross-border billing and other municipalities not, or delaying their overall payment back to the municipalities working with them, they're looking at a system from the province to take your actual cross-border billing off your bottom line of basically your payments coming in, but that has not been realized. So what we're doing is we take an estimate of what we see for people doing calls in our area, vice versa for our billing. That's where we come up with our actual figure. If there's an increase in calls to Brant, it would be unproportionate to what the amount is, or if we do more calls in the Hamilton area, helping them out. So right now, it's the best educated guess due to figures we have.
Okay. For the cross-border calls, have they established a fixed fee for that, or is it variable depending on the expenses in the community?
There, through you, Mr. Chair, there is a set formula from actually a transport vehicle to, say, an emergency response vehicle. Each and every call is broken down to a full crew going, or an emergency response, say, even to the portion of a standby, and that's how the billing is. But the same figure, same dollar amount is province-wide.
Okay. And are they still bringing ambulances into Brant just to stand by if all our ambulances are busy?
Through you, Mr. Chair, currently right now that has not been the practice dealing with COVID. We basically have been trying to maintain our own, and there's been no need over the last basically 4 or 5 months as much as we've had in the past.
Okay.
One more, Councillor Martin, and I can come back to you. I just want to make sure everybody gets in.
Yeah, okay. 21014, snow removal, an increase to 68%. Because snow removal is something that fluctuates year to year, is that not something that you try to average out?
Through you, Mr. Chair, in the previous contracts at any one of our stations, we did not have the portion of salt. So we estimated as per actuals in the 2019 budget of 9,682. We increased it to actuals, so that 67.9% increase could be less or more for previous years. But we're building it on the 2019 actuals when we started adding salt to the snow removing contracts.
Okay.
Which is,
just come back to me, Mr. Chairman, when
I will. I just want to make sure that your colleague John Sless can have his question answered. Councillor Sless?
Yes, thank you. Just a question on the insurance. The liability insurance is going up about 23.5%, and the vehicle insurance up about 18 point something. Have we gone back out to the market to see if we can't do better?
Russ or Heather or Cindy? Question about insurance.
Whoever can answer it would be fine.
I think there might have just been a muting issue here.
Yep. Thank you, Mr. Chair. It's Michael. So we marketed for insurance in 2018, and then we actually then changed insurers again in 2019. So I would believe that that's, and I know the entire municipal insurance, and I'm sure City Council will be seeing similar numbers. We have the same insurer, I believe, but the entire insurance industry right now is basically increasing aggressively year over year this year. So that's based on our current insurance renewal, which is actually going to council next week. It does have a fairly hefty increase this year. Again, we did market our insurance program in 2018. We don't think we can market every year. We won't get the bids. We don't get a lot of bids anyways. Most municipal insurance marketing don't get a big return. So we try to market every 5 years. That's our position. But again, based on what I'm hearing in my municipal circles, insurance rates are going up pretty much across the board. Thank you.
Do you have no? Okay, I know Councillor Pierce had his hand up, as did Councillor Martin. Oh, Councillor Pierce didn't. Okay, anything from either of the mayors before I go back to Councillor Martin? Mayor Davis.
Yeah, so I guess we're not using the raised hand participant box.
No, we've been using this for the just general hand in the county meetings. Have you been using the raised hand?
Yep. Anyways, I'm sorry, I have another meeting I have to jump to in 2 minutes, but I did have a couple of questions. Unfortunately, I'm not gonna be able to ask them all. But so the first one is dealing with the largest single items in this budget, the operating budget, salaries and admin overhead. So those are obviously built upon certain assumptions as to what will transpire during the collective bargaining process. Is that the main factor in those increases?
Through you, Mr. Chair. Yes, so there's an assumption on exactly what you said, what negotiations may result in. And then as well, as was noted in the report, there's also an annualization of the new 12-hour car that was put on the road and the 4 staff to staff that car.
So when you deal with that type of question in the county, how do you normally deal with it? Because if you got a question about what the assumption is, do you go in camera to get it? I assume you must.
Yes, we wouldn't disclose
No,
that.
I don't think so. So I got that question. I'd like to know what the assumption is. So how do we get that information?
Would you like a motion to go in camera?
Yeah. I'm torn because I really truly have to leave in about 2 minutes. I mean, when no one else is really interested, then what's the sense of it? But I think that's useful information to have, right?
We can still go in camera and you'll still get the minutes, the in-camera minutes after.
Well, I would move, and I may not be able to hear it, but to go on camera to hear what those assumptions are.
Okay, is there a seconder? Councillor Martin, all those in favor? Opposed?
Receive the budget today and seek further information to come forward as a subsequent meeting. Alternatively, you could just approve the budget today. So I just wanted to clarify that this is, the committee has different options on what to do with this budget today. And one of them could be to receive it for information and seek further information at a subsequent meeting. I think it's worth noting, we're late delivering this budget to the city. We have given them have advised them to set the budget based on last year's budget for their work purposes. The county won't be starting its budget for a few months yet, so we're in good time from the county. So I just wanted to clarify that for committee, just so you know where you are in the budget process.
I'd like to clarify that we're late from the early request of the city for the budget. Like it's something we do early anyway, and it's still early compared to the rest of our budgeting process, and this is a county service. So, Councillor Sluss, did you have a comment on that before we move on?
I did, because the recommendation indicates to approve, and I think I don't know about others. I'd feel better receiving as opposed to approving. I don't know whether that requires an amendment or how you'd want to proceed, Mr. Chair.
Currently, we're what's on the floor is, are we going to go out of camera? And then we can So let's get that out of the way first, and then it's a valid question. Let's just get to it when we're back out of camera. Okay, so all those in favor of leaving the in-camera portion of this meeting? Okay, that's everybody. So we're going to go out of camera. We're going to go back into the public record. Heather's going to let us know when the YouTube stream is back online.
Yeah, we're back.
Okay, so we are back from in camera. We have a question. Does somebody want to repeat the question regarding reserve funds? There's a question regarding reserve funds that we moved back into the public record to ask about. So does a staff member want to respond to that question? I am stating it because the member who asked for it to be asked is not able to be here.
Mr. Chair, through you, it's Michael. Yeah, so I think Mayor Davis had a question, and he's had to leave the meeting on, in terms of the decision package, which is to increase our reserve fund from its current contribution rate to the contribution rate that we had in last year's budget, previous budget. So his question is, can we provide options? And we can provide any number of options that committee wants. It would be good if we could have some direction, maybe from committee. Do you want, increments of $50,000 and what that would do to the tax levy impact, or would you like to see, a halfway point? And also, would you like options on what that would do to the capital fund and going forward, because that does put some future concerns in place, such as that reserve drawing down into a negative, or potentially becoming an underfunded or permanently negative reserve. So we would need, we can provide whatever options that committee would like. It would be good to have some direction on what those options would look like. Thank you.
Before we get to that, Michael, I'd like to ask a question on history, because this is the first recorded and publicly available meeting of the Paramedic Services Committee. When we discussed last year the drawing down on reserves, can you provide a little history on that? Because my understanding, being chair at the time, was that was being considered as a one-time use of reserve funds that would normally be earmarked towards reserve for things like maintenance and our paramedic infrastructure, being used this one time to help out with a tough budget. Am I incorrect or correct on that? And can you provide a little color on that before we get to the next questions?
Thank you, Mr. Chair. Yeah, so our recollection, or at least our intent for this budget was to bring that back. So I will recall from last year's budget, we did present some upstaffing to address call volume increases and an erosion of capacity for our service to be able to service those increasing call volumes. And I think that there was a strategy that was put in place by committee to approve that upstaffing, but then to reduce the contribution to reserve, noting that the reserve has adequate funds in it, certainly to meet its last year's capital needs and this year's capital needs. But I think it was our intent that we would bring that contribution back. We've included the reserve plan in the decision package, so it does show that those funds have a long-term need. We do have long-term annual capital needs, and that amount that's that we're proposing in the as an annual reserve contribution is required to fund that long-term capital needs. So we built, as you can see from the decision package that's included in the budget presentation, the reserve basically over 10 years does just basically spend most of the money that it would have. So obviously that on a annual basis we need to retool that reserve. My intent is to build the reserve as a sinking fund, where it always basically nets out to zero over the course of a number of years. So it doesn't become an overfunded reserve. So it's certainly not an overfunded reserve, but at this point we believe that it is required to fund the future capital needs of the service. Hopefully that answers it.
Yes, and if I recall correctly, we were also discussing that in the context of the provincial government at the time, discussing absorbing all of the paramedic services and molding them into 14 mega services, which seems to be on hold, if I'm correct.
Through you, Mr. Chair, there has been no further discussions regarding a mega service. It has not even been brought up since our last talk early last year.
Thank you. I think that's good color for those back in the meeting, but also those who are watching at home. Okay, so we have an option. We have options here around what we want staff to come back with regarding reserve options. If anybody would like to make a recommendation or a staff request, Councilor Pierce.
Thank you, Mr. Chair, through you. So just regarding the 200 that was taken out, that was my recollection as well, as that was going to be a one-time thing, that we were going to take that out to expedite the funding of the extra vehicle for the 12 hours and the staff included in that. So I'm quite fine with the two options that are there, to put us back as we were, or to not put us back as we were, and as it says, status quo. And you can see by the bottom line there that by the time we reach the end of that, we're quite a chunk in debt, and then it's going to have to require more input into that. So I'm quite fine with the two options that are there, and I'm in favor of putting the 200,000 back into it to put us back into where we were.
Okay. Councillor Sluss.
Thank you, Mr. Chair. I think part of it too was to not have a very substantial amount of money in a reserve in the event that there was an amalgamation, that things did get muddled together. We could end up coming up short. And well, there's been no talk about it. It's understandable there's been no talk about it with what's going on in the healthcare business. So I wouldn't assume that it's dead. I would assume that they were too busy to be dealing with it at that time. But there's no reason to believe that their intent was to go down some sort of road, and there's no reason to believe that still isn't the intent. What I got from the city mayor, Mayor Davis, was that he would like some options. It doesn't mean anything's being approved. It means we can look at it, I guess, a little more in depth. Typically, through our budget process, staff will give you 3 or 4 scenarios. It could look like this, it could look like that, or it could like this over here. And I think that's what he's asking for, not for us to give them direction. If we give them direction, then we don't need options. We would simply move a direction. But what we're looking for is some options that are potential roads to go down.
Okay. If somebody would like to make a recommendation, Councilor Martin.
Yeah, I would like to move that we receive the budget report and seek further options for the reserve fund contribution for our next meeting, and also answers to any of the other questions that come up during the further discussion.
Okay. Is there a seconder? Councillor Sluss is seconded. All those in favor? Opposed? It passes. Okay.
Thank you.
So that takes care of the staff report, I believe, because that's what we were voting on. Yes, Councillor Martin.
Yeah, I had further questions when I ran out of time there. So.
Yeah, no, I know you did, but then you moved it then. So sorry about that. I thought there might be questions. That was the time to do that. We can move it to comments if you'd like, because we've already passed the resolution. But yeah, if you have.
Well, no, we passed the amendment to ask for additional information to come back. We haven't passed the resolution that's on the floor yet. And I still had questions on the budget.
Give me 1 second here. Heather, can you weigh in on this?
So the recommendations that are approved is to receive the budget and seek further options for the reserve fund for the next meeting. But it also said to answer any questions. So I suggest we could probably take more questions, just noting that some of those answers might be coming back at the next meeting.
Mm-hmm. Okay, so yeah.
Well, point of clarification, Mr. Chairman, what I moved was an amendment to what was on the floor, that instead of approving the budget, that we receive it. The amendment carried. The resolution is still on the floor, and I have further questions on the budget.
And your questions will be answered either way, but I just want to make sure that my understanding of the wording of your actual motion, the way you worded it, was to receive the budget with. That was
amending the motion that was on the floor.
I didn't see that as an amendment. I saw that as you were moving.
Well, Mr. Chairman, there was already a motion on the floor. I was not replacing that motion. I was simply amending it. My amendment to that motion carried. Now the motion as amended is still on the floor, open for discussion.
Okay, so let's get back to the clerk to have her weigh in.
I'm not sure that a motion was on the floor, but I'm checking into that, so.
Okay.
Our understanding is there was no motion on the floor for the original motion. The only motion made was the
Okay.
revised
Because-
one from Councillor Martin.
Right, that was my understanding as well, because we had the budget presentation. I didn't think that we actually had a motion on the floor, just that we were in presentation mode. And the questions were being asked of the presentation. Now, if you'd like to recant,
Okay.
send your motion, because it wasn't an amendment. As you said, I'd
No,
like
that's fine. I'll just put
I'd
my
like to make an
questions to
amendment.
staff and they can come back when this issue comes back again.
Okay, so ask your questions and
Yeah, on that salary line, it was indicated that a portion of that was the annualization of the paramedics added last year or in the last budget. Can staff tell us how much of that 415 is annualization? And if I have to wait for that, my other question is regarding utilities. All the utilities seem to be over budgeted. They've been reduced, but it looks like there's enough room to reduce them even more. Like the reductions only go about halfway to bringing them back down to the actuals. So I think that needs to be looked at as well. And also on page 52, the actuals don't line up with the budgeted items. And I'd like an explanation for that, because there's a whole bunch of actual expenses with nothing budgeted, and there's a bunch of budgeted items with nothing actually spent. So if that could be clarified when this comes back, I'd appreciate it.
okay. No, unfortunately, unless you want to reverse the motion and get it back on the floor.
I'm sure staff have my questions and they can address those when this comes back.
I'm just clarifying that you don't want to go back to what we were talking about and reverse your original motion, because you had made a motion. I'm just making sure that I don't want to be.
No, I apologize. My understanding was there was a motion on the floor to approve the budget. I didn't realize it hadn't been moved yet. That was my mistake.
Because we were still in presentation.
Yep.
Okay, so with that, unfortunately, no communications. Next meeting is at the call of the chair, and I'll seek to adjourn. Mayor Bailey, thank you. We are adjourned until next meeting.
Thanks, everybody.